Hello everybody, my name is Sita Benoit. I am a second-year resident in endodontics at the Catholic University of Leuven in Belgium. I would like to begin with thanking the European Society of Endodontology for this opportunity to present this video to you today. I will present two cases in which I took intentional reimplantation using the Bennex extraction system as a solution for deep fractures. Trauma remains a significant challenge for dentists worldwide. Deep fracture lines below the bone level, whether or not they involve the nerve, complicate treatment planning and require careful consideration. While implants and prosthetics can sometimes provide a solution, they are not always feasible and are often less favorable than preserving the natural tooth, especially for younger patients. Therefore, finding effective strategies to maintain natural dentition remains crucial in modern dentistry and endodontics. This first case involves a 26-year-old patient with a long history of trauma. In 2023, she had previously lost tooth 12 due to trauma. Cone beam CT scan from 2023 shows a deep complicated crown root fracture on tooth number 12. When we scroll even further, we can also see an alveolar bone fracture vestibular on tooth number 13. There is also an apical lesion present. Tooth 12 was removed and replaced by an implant. In November 2024, the patient fell again. There was a complicated horizontal root fracture on tooth 21, with fracture line located above the bone level on the buccal side and below the bone level on the palatal side. An uncomplicated enamel fracture extending below the gingiva and bone level on tooth 11. We can also see that the apical lesion on tooth 13 has not yet been treated. This was later performed in our endodontic department. On the first urgency appointment, the teeth were temporarily splinted. We will now focus only on the treatment performed on tooth 21. An atraumatic extraction of tooth 21 was carried out using the Bennex extraction system. The tooth was then rotated 180 degrees so that the fracture line was above the gingival level on all sides. The first part of the endodontic treatment was performed, filling the coronal 2/3 with calcium hydroxide, and the tooth was closed off using glass ionomer. The root fracture was then splinted on the vestibular side to the neighboring teeth. An aesthetic temporary solution was provided by splinting the tooth crown with a glass fiber splint. After 2 weeks of healing, the definitive endodontic treatment was performed using 3% sodium hypochlorite, 17% EDTA, and an eddy sonic activation tip. AH+ was used as root canal sealer with an amino epoxy resin base. The tooth was then closed off using composite, and the crown fragment was again splinted for aesthetic reasons. The patient was then referred to the restorative department for a crown. This case shows that intentional reimplantation can be a solution for difficult fracture lines under the gingival tissue or bone. I will now present a case where I performed the same treatment, this time with 1-year follow-up. This 19-year-old patient came in with a complicated crown root fracture on tooth 22. The same intentional reimplantation was performed using the same protocol. These x-rays show the final endodontic treatment and follow-up after 1 and 6 months. On the 1-year follow-up, a new cone beam CT was taken. We can see good healing on the periodontal ligament, but a small resorption site mesially. Apically, the tissues are still in ongoing healing. The patient was now referred to the restorative department for a definitive crown. Thanks to this technique, these 2 young patients could retain their trauma teeth, avoiding implants on a very young age. This technique may be a valuable tool for the management of deep fractures. Thank you.